Hi, I'm Dr. Peter Osborne, founder of Gluten-Free Society, and I'm here in the manufacturing plant where all my products are made. I wanted to give you a behind-the-scenes tour to show you how we make my products so you can be as confident as I am that they are safe, powerful, and effective. In step one, when a raw material ingredient arrives at the facility, we first need to make sure it really is what our supplier says it is. For instance, if we ordered magnesium, we test to verify that that's what they shipped. Then we further test to ensure it has zero issues with harmful bacteria or heavy metal levels. Why do we do this? I want proof from the start that you're getting clean, safe ingredients. This step exceeds industry standards, but I wouldn't have it any other way. Then comes step two. Once all the raw materials pass this first step of quality control, they're weighed individually so the right ingredients and the right amounts end up in your supplements. They're blended in specialized machinery to make sure you get the same product each and every time. During step three, the product is packaged and goes to the lab for its final round of testing. In this stage, we confirm that what's on the label is in the product and retest to ensure nothing unexpected has snuck in. Testing before, during, and after might seem redundant to you, but we want to be absolutely certain you can trust these products. By the way, if you get your supplements somewhere else, there's a chance they may not have been tested at all. I use these products in my clinic, I use them myself, I use them with my friends and family and loved ones, and most importantly, I share them with you, knowing you'll see powerful results in your own health. And as always, we want to make sure you have access to high quality, gluten-free products so that when you're looking for supplements to take, you don't have to worry about cross-contamination issues that could make you sick. Most allergy medications work by inhibiting the immune system. This inhibition comes with many unwanted side effects, and some of them affect your ability to produce stomach acid. Now, for those of you with a history of gluten sensitivity or celiac disease, this can be a problem because your digestion may already be compromised. And that's why I developed Hist Assist. This all-natural formula works with your body to support the immune system's healthy response to seasonal discomfort caused by allergies. The unique ingredients in this formula include vitamin C. Now, vitamin C has many immune-boosting properties, but it is distinctively beneficial for individuals with seasonal discomfort because of its ability to deactivate histamine. Quercetin, a powerful flavonoid to support healthy histamine levels, quercetin also has strong antioxidant activity and has been shown to support immune health by mediating the release of inflammatory compounds. Hist Assist also contains bromelain, which enhances the absorption of quercetin and supports mucosal tissue health. Additionally, it contains stinging nettles to help support a healthy immune response. And finally, N-acetylcysteine, otherwise known as NAC. Now, NAC helps clear the airways by promoting normal viscosity of mucus. This powerful combination actively promotes healthy nasal and sinus passages for those struggling with elevated histamine and respiratory irritation. Now, like all of our products, Hist Assist is gluten-free. It's also free of soy, any animal or dairy products, fish, shellfish, peanuts, tree nuts, egg, artificial colors, artificial sweeteners, or preservatives. Now, for daily use, take 2 capsules per day. For optimal use, take 4 capsules a day during allergy season. And for high stress, high allergy times, you can take between 6 and 8 capsules a day very safely. Hey everybody, welcome to Pick Dr. Osborne's Brain. Today we've got a great live Q&A for you. If you've got questions specifically about nutrition and general health, you can go ahead and put those now into the chat box. And if you're new to the show, make sure that you come visit us at Gluten Free Society, check out our sponsor, and sign up there for our newsletter. You'll get a whole bunch of free resources and information to help you navigate diet change and nutrition. And it's a great place to start if you're just getting your toes wet into this world of functional nutrition. And that's glutenfreesociety.org. You can sign up there on the homepage for those free bonuses and giveaways that, again, can be very helpful for you as you navigate or try to navigate your health. So let's dive into your questions today. So Holly asks, she says, I'm bloated and tired. Saw a holistic doctor and he thought I was gluten sensitive. He did a Nordic Dutch test. Genetics were negative. Well, first of all, the problem with that is they're only looking for DQ2 and DQ8, Holly, and so doesn't mean that you're not doesn't mean that you're not gluten sensitive. It just simply means that you don't have a likelihood of developing celiac disease, and they're not the same thing. So, you might ask your doctor instead of that to run what's called an HLA-DQ genetic analysis, looking specifically not just at HLA-DQ2 and 8, but also at HLA-DQ1 and 3. Now, I know that's a mouthful, and if you don't understand the genetics of gluten, then just take notes and take that in. He should understand it. Now, if he doesn't, and you're still trying to get an answer as to whether or not going gluten-free is a good move for you, you can do our genetic testing online, and I'll put a link up below for you in the feed, but do the genetic testing online. You don't need a doctor's note, and it will give you the full spectrum of analysis that is required in order to understand whether or not you have that genetic predisposition. So let's see here. Diagnosed with ankylosing spondylitis or spondyloarthritis 4 months ago. I eliminate dairy and wheat and my symptoms are 50% improved after 1.5 months. But in the last 2 weeks, my improvements have plateaued. What can I do? I would say, if you're avoiding wheat and dairy, those are, of course, wheat contains gluten, but it's not the only grain that contains gluten. And so that's where you probably are needing to do an additional dietary restriction away from grain, not just from wheat, and see if that plateau doesn't break. I'd also encourage you, Sabrul, to read No Grain, No Pain, and that's a really good place to start if you've got an autoimmune arthritis. That's actually why I wrote that book, was based on decades of experience of helping people with those types of autoimmune conditions recover with diet and lifestyle change. So that's a really good place to start. You've made some really key diet changes, so kudos for those changes, but you might just want to do a little bit more. And so reading that book is going to be a good place to go next. So I watched your recent interview with Dr. Jill. What is cytokine inflammation and what lab markers look for? So there are a lot of different types of cytokines, generally speaking, Sujanya. And if you're asking what is a cytokine storm or cytokine inflammation, it's a battery of different types of chemicals that white blood cells can produce that, when elevated, create a lot of symptoms. And a good doctor can order panels that will measure different chemicals that are cytokines. Interleukins and TNF alpha are examples of different types of cytokines that can be measured. A lot of doctors that aren't, specifically a lot of doctors who aren't, let's just say, rheumatologists, because usually the doctors that would order these types of panels would be rheumatologists. So your general doctor, your GP, may not have an expertise in looking at these types of panels, so a rheumatologist might be a good referral to get some of these things looked at. How can I raise my cholesterol? I follow the No Grain, No Pain book and love it. I eat so clean now, and my total cholesterol dropped to 155. for good hormone production, do I need to raise it? No. Depending on your weight and your age, 155 is not necessarily bad if that's your total cholesterol. You don't necessarily need to do things more. In research, what we've seen in men is that when men's cholesterol starts to drop below 150, there is an increased chance, this isn't 100% across the board, but there is an increased chance of symptoms of depression. So if you're feeling good and doing well, I wouldn't worry about necessarily trying to raise your cholesterol. Remember, dietary change, as far as like eating animal-based foods or eating more cholesterol, diet is not going to elevate your cholesterol to any huge, significant extent. Most of cholesterol production is under the auspice of the liver and has less to do with actually eating foods that contain cholesterol. Now, that being said, without knowing more about you, it's hard to know whether or not eating more animal meats may be something that might be beneficial for you. But I wouldn't be concerned by that level if you're eating clean and you're feeling healthy and feeling well. Oh, thanks for the compliment. So he says you're the best, and your older shows are also amazing to watch over and keep learning. So yeah, so those of you that don't know, we have over 1,400 videos in our library, and so that's 1,000 plus hours of information that you can watch. So if you are not familiar with that, remember on our YouTube channel, just go back and check out our archives and type in a search term, and you'll probably find that the topic you're interested in is being covered by me. And if not, send me an email, because if there's a topic that you don't see that you would like to see me cover, we're always looking for show ideas to help better serve you guys. So if you see a topic you'd like me to cover, or don't see a topic you'd like me to cover, let me know. What's the test to know if you have mold in your gut, and will it tell you what kind of mold? So if you're talking specifically about the gut, the best way to understand whether or not you have mold, and really technically yeast would be a better term, Lynn, would be to do a stool analysis. And so with a stool analysis, not only can you identify whether or not you have yeast there, but which kinds of yeast and quantitatively how much is there. An organic acid test doesn't really give you that information. An organic acid test can tell you whether or not you are making certain chemicals that that might mean you could have a high level of yeast or certain types of bacteria. But organic acid testing is speculative at best, because well, let me give you an analogy. If you walk outside and the driveway is wet, most people would make the inference that it rained, but maybe it didn't rain. Maybe the sprinkler was on. Maybe somebody washed their car. Maybe a pipe broke. There are other potential possibilities, and organic acid testing is not a definitive test that says, hey, you have yeast in you. It's a test that says, hey, you have some of the chemicals that we know yeast can produce at higher quantities, but other things can make these chemicals, and it's not just yeast. So that test is limited in its capacity to truly tell you whether or not definitively you have an issue. So it's not one that I would recommend if you're trying to specifically understand whether or not you have a yeast overgrowth in your GI tract. How do we support liver and kidneys when doing a mold detox? One of my favorite supplements to use for support is called Ultra Liver Detox. We can put a link in for you, but Ultra Liver Detox, it's got a mixture of different things, lipoic acid and N-acetylcysteine, and certain types of broccoli extracts that are very, very helpful and supportive of liver detoxification. Both what's called phase 1 detoxification as well as phase 2 detoxification in the liver are both being supported by that. So that's something I would highly encourage. As far as supporting your kidneys, in my opinion, the best thing you can do to support your kidneys during detox is hydrate, and hydrate well. So kind of a general rule around hydration is with detox is, and this is just clinically, this is just my experience, but you should be peeing 6 to 8 times a day And it should be a relatively large volume of urine output because, again, as you're detoxing, you're trying to flush things out of you. And the way we flush things out of us are through our urine, through our sweat, and then also through our stool. So if you want to support your kidneys, just keep them really hydrated so that you don't get toxic backup. Could my hormones and periods not work due to food or stress? So yes, to both. Many women who become overly stressed actually report hormone disruption or hormone dysfunction, and then food, definitely. There's actually a condition for people with gluten issues called polyglandular syndrome, and this is where gluten impacts or affects multiple organs responsible for the production and excretion of different types of hormones. And so, for example, thyroid is a type of hormone, cortisol is a type of hormone, estrogen and progesterone and testosterone are types of hormones. And we know, as an example, gluten has been shown to affect all of those hormones, not just the sex steroids. So it's very possible that your diet could be contributing to some of that abnormality. Any update on our products being available in the UK? No, we're still working on that, and I think we're almost close, Leah. But I don't want to promise anything because it's the devil's in the details. So we'll make that announcement though as soon as we have something worked out. Let's see here. When will Warrior Bread be back in stock? It's going to be back in stock at the end of this month, is what we're anticipating. So if you're waiting on that, then hopefully you'll see that out of stock notification go away by the end of the month. But that's what we're anticipating. Does sleeping with a healthy or with a heating pad raise blood sugar? My A1C is 5.2, fasting insulin 2.6, glucose 77. I like to sleep with the window open and use a heating pad. No, heating pads are not, to my knowledge, don't affect your fasting sugar or raise your blood sugar. Sudden cramps in hands and legs in 20 years, diabetic, blood pressure I'm not sure I understand it. So sudden cramps in the hands and legs in 20 years, diabetic, metformin plus blood pressure that takes B12, D3, and ALA CoQ10 since 1 month, daily doses, what can cause it? So if you just got sudden cramps in your hands and legs and you're on a blood pressure medication, one of the there's 3 things you need to be thinking about. One is potassium, another is calcium, and another is magnesium. Those 3 minerals, generally speaking, when they start dropping, and they can drop depending on what kind of blood pressure medication you're taking. A lot of these medicines are diuretics, and so they cause magnesium, calcium, and potassium loss. And so cramping is a very common side effect of using these medicines over any length of time. So that's where I would look to ask your doctor to measure your potassium, your calcium, your magnesium, intracellularly specifically. Usually when they measure them, they measure it in the serum, and that's not really an accurate indicator because the levels in the serum are very tightly regulated by hormones. But if you look inside the cell, that's where you're going to actually identify those deficiencies. And the other thing you can attempt to do is consume more potassium, calcium, and magnesium through your diet, or even potentially supplement with them. But that's where I would start, because cramping is a very common side effect of blood pressure medications, especially the diuretics. If we have food sensitivities, or if we do a food sensitivity test and remove those foods after healing a leaky gut caused by gluten, let's see here. Let me make sure I understand this question. So if we do a food sensitivities test, does the test result change, and can we eat more foods after healing a leaky gut caused by gluten? So the answer to that is, to both questions, is yes. So the results, remember, your immune system is, generally speaking, has about a 6-month life cycle. So the cells of your immune system, they're born and they live for about 6 months, and then they die and are replaced. And so what we see clinically in a lot of folks is food sensitivities do change. And this is why a lot of people struggle getting better, because they measure it one time and they never measure it again. And it's possible that there are some changes and ebbs and flows. So what happens a lot of times when people are trying to use diet change to affect their health and overcome an autoimmune problem, their first 6 months, they have these really good results, and then they start plateauing. And a lot of times it's because they can change, those results can change. And so it sometimes can be helpful to get a reread on what food sensitivities you have to make additional dietary adjustments. But at the end of the day, once you overcome and your gut is sealed and healthy, then your reactivity to food diminishes greatly in terms of bad reactivity. So you develop better toleration or better immune tolerance of many, many foods as your gut is healed and sealed. What test or parameter to find out if there's a low cortisol or adrenal related issue? It's several tests, it's not one. You can have your cortisol measured in your blood. Your regular doctor can do that. The problem with getting a single read on cortisol is it's a diurnal hormone. So it's high in the morning, lower at noon, even lower in the afternoon, and then even lower at night. So it kind of forms a lazy L curve in terms of quantity that you produce as the day goes on. And then you sleep and it stays low, and then it spikes in the morning to wake you up. So getting cortisol measured with one marker is sometimes misleading. Now, what some doctors do is they'll do an adrenal stimulation test. They'll stimulate your adrenals, and then they'll measure your cortisol output and what's called your adrenocorticotropic hormone, which is another blood test that can be measured. But my favorite way to look at adrenal markers is to look at cortisol 4 different times of the day, those 4 different time points: morning, noon, afternoon, and evening. And that way you get more of a pattern of what actually is happening for that person to see, because sometimes you can have a pattern that's indicative of adrenal fatigue or adrenal loss of adrenal function, but it may not be specifically in the morning time. And then there are other markers that need to be looked at as well. DHEA is a very important marker to look at. You can also look at some of the catecholamines like epinephrine and norepinephrine, which are produced by adrenal glands. You can look at pregnenolone and 17-hydroxyprogesterone are good markers to look at as well. So again, it's not one test, Mario. It's many things that you have to take into consideration. Also, nutritionally, for example, vitamin C and vitamin B5 are essential for your adrenal glands to function and for your body to be able to produce those adrenal gland hormones. And so if you're vitamin B5 or vitamin C deficient, that can also impact their function. So it's in depth, it's complicated. It's why a lot of doctors don't do it, because they don't have time to go deep, because they got, the way the mainstream medical model oftentimes is set up is that doctor's got 50 patients today and he's maybe got 3 or 4 minutes with each one. And there's not a lot of time in that 3 or 4 minute time span to be thorough. So part of it depends on the kind of doctor that you visit too. If the doctor you're visiting has got 50 people lined up in a waiting room, then you might want to reevaluate what kind of doctor you want to visit, because a good doctor, in my opinion, will spend a lot of good quality time with you and help you navigate those issues effectively. Let's see, what happens if you reintroduce food too quickly after a prolonged fast? Lots of different things could happen. It depends on the length of the fast. So, I mean, if you've been on like a 4+ day water fast, you want to go real slow, because your GI tract slows down, its functionality slows down, and if you bombard it with a major meal after a long-term fast, there's a lot of things that can happen. You can get pain, you can get gas, you can get bloating, you can get a lot of nausea. So these are all potential side effects, and that can set the stage for some major constipation that could occur as well. So it's always best after a long or prolonged fast to reintroduce things. A lot of times I like to have people reintroduce kind of liquids or purees of food and do that first to get the GI tract primed and turned back up and on. Can you tolerate gluten if the microbiome is super healthy? That's a really good question, Albin. I'm going to answer it two ways, because some would argue that yes, you could tolerate it better. I would argue that if you're gluten sensitive, you shouldn't be eating gluten no matter how healthy your microbiome is. If you're gluten sensitive, one way to destroy your microbiome's health is to consume gluten. This is clear in the research. We know that gluten alters the microbiome. So let's say you're starting at a point where your microbiome is really solid, but you're eating this gluten, and that gluten is damaging your microbiome over time. And it's that damage over time that accumulates that leads to not necessarily the sudden onset of symptoms, but the slow progression of poor health over time. Remember, gluten is one of the slow poisons. It's unfortunate. Some people, when they get exposure, have an acute response, like they're vomiting, they've got severe diarrhea, they've got severe pain. But most people, even with gluten sensitivity, they don't feel tremendously horrible immediately after their exposure. It's a chronicity of exposure over time, and that can destroy and damage the microbiome. So I would argue that people with healthy microbiomes, one of the ways you can destroy a good healthy microbiome is by the consumption of gluten, but that damage doesn't happen all in one meal. It happens generally slower over time. Penny asks, what is PDOB? That stands for Pick Dr. Osborne's Brain. So welcome to the show, Penny. If shown severe deficiency in, I don't know what you mean by CAR, I would assume carnitine, but I don't want to make an assumption. Selenium, DHA, magnesium, vitamin A, tryptophan, citrulline, and glutamine. Okay, in a serum test, can I consider it true? And if taking high doses of all, what other deficiency can... So, I mean, if you've got deficiencies of those nutrients in a serum test, yes, you would consider that they're low. Serum testing is accurate when you have a deficiency. Where serum testing is less accurate is if you don't, because serum can be influenced greatly by the day-to-day nutrition. But if you're low on a serum test, then the likelihood that you need to incorporate those nutrients more in your diet is also very high. It's just not, again, serum testing is not the way that I would encourage anybody to monitor their nutrition over the long term. How do you add electrolytes back to water filtered by RO, reverse osmosis? Very simply, you get an electrolyte formula and add it. If you're using ours, ISA, we have one called Ultra Electrolytes, designed for this very purpose. And that the dosing on that would be you'd add a half a teaspoon for every 20 ounces of water that you are drinking. So if you've got a 20-ounce water cup, put a half a teaspoon of the electrolyte in there, and that will replenish it. And I can put a link up below for Ultra Electrolytes for you. What should melatonin be paired with for the most effective purpose of inducing sleep, or is it fine to take alone? It's different with different people. I think some people do just fine supplementing melatonin to improve or help support their sleep. For others, it doesn't work very well. I think part of it depends on why you're not sleeping. So really, an assessment of why you're not sleeping would go a lot further than just saying, okay, melatonin, and pairing that with something else like valerian or chamomile or lemon balm or GABA or theanine. These are all different great things that could be used to help induce relaxation to improve sleep. Magnesium can also be used. But at the end of the day, all of these types of supplements are only helpful. You want to figure out why it is you're not sleeping. Now, why you're not sleeping is because you're deficient in melatonin, then there's a natural solution for that, which is called sunshine, right? And that doesn't cost you anything, so go outside. But if it's in the middle of winter, it may be, especially if you live in northern climates, that might be more of a challenge. So melatonin for many people is very helpful in that regard. You might check out our show on sleep. I did a really comprehensive show not very long ago on sleep where you can do a deeper dive on that topic. So when's the best time to check for T3, free T3 on your thyroid labs? The time of day, before or after taking the medication, etc. There are different opinions on this, and I'll give you mine. The best time to take it is generally fasted in the morning, and with, after you have taken your medication. So if you're taking a thyroid medication, you want to see what your levels are in your blood with that medication being inclusive of the test. Meaning if you're taking your blood work and you didn't use your medication, then what you're actually seeing is a potentially false low level of T3, especially if you rely on medicinal T3 to elevate your levels. So if you take your blood work before you take your medication, then what may end up happening is your doctor may increase your medication because your level's low, and that may not be an accurate increase. So it's always best to take your blood. One, it's important. I like to take it in the morning. And so every time that person takes it, they take it in the morning because that's consistency. We want to compare apples to apples. But number two, if they're on medication, they need to have taken that medication before they draw their blood. If you're not on medication, then just doing a fasted morning level should be adequate to assess, your T3 levels. What do I think about a small enema to introduce probiotics to the colon? I have SIBO history and worry about taking them orally. I think if you're worried about taking a probiotic orally, a lot of people with a SIBO history don't do well with high doses of things like bifidobacter, lactobacillus, but do really, really well orally with spore probiotics. And I don't know if you've used those before. We have something called Biotic Force that you might try. It's a spore-based probiotic that, again, doesn't tend to aggravate people that have SIBO. Now, as far as rectally doing probiotics, I think if you're doing that, one of the best things to do is to do it under medical supervision. They actually do now, they do what are called fecal transplants, where they take healthy fecal specimens from a healthy donor, and they transfer that rectally to a person who is struggling in their health. And this is actually being done. There's a lot of research coming out on fecal microbiota transplants being very, very effective for people that have inflammatory bowel issues like Crohn's and ulcerative colitis. We've actually got a guest speaker coming on, a gastroenterologist coming on here to the show here very soon. You'll see that episode rolling out where she's an expert in that, and we're going to pick her brain on that particular topic. So it's probably going to be a show you're not going to want to miss. Are any of your supplements considered blood thinners? So supplements are not blood thinners. Let's define thinning the blood versus blood viscosity to really answer this question. If you eat an inflammatory diet, high in sugar and processed food, the effect of high inflammation over time makes your blood thicker, makes your viscosity of your blood thicker and stickier. Now, that's not normal, okay? Now, traditionally in medicine, what doctors do is when they get a patient like that, where the blood viscosity is too thick and their clotting is too thick, is they don't tell them go change your diet, because diet can thin your blood, right? Or reduce the inflammation. They're normalizing the blood viscosity. So technically it's not really thinning your blood. It's just returning your blood to the proper viscosity that it's supposed to be, right? Or you can take a blood thinner that inhibits, there are different kinds of blood thinners, classic blood thinners like warfarin inhibit vitamin K, which is a very important nutrient in the blood coagulation cascade. But do supplements thin the blood, or do supplements help normalize blood viscosity? I think that's an academic question, but I think it's one, again, worth entertaining, because things like fish oil, for example, and vitamin E, your body needs. They're essential. And a lot of people are vitamin E and omega-3 fatty acid deficient. And when you're deficient in those nutrients, your blood is thicker, because those nutrients help support normal blood viscosity. So a lot of doctors would call vitamin E or call omega-3 blood thinners, when technically they don't thin your blood. They just maintain normal viscosity of the blood. So, and this is why when you go to like pre-surgery, they don't want you taking things like vitamin E or omega-3, because they're worried that when they go in to do the surgery that your blood will be too thin, and then it will create bleeding complications during the procedure. But technically, omega-3 doesn't really thin the blood, but it maintains healthy blood. So I think it's important to understand that. Now, there are supplements that can thin the blood. And one of the classic ones is nattokinase, which is an enzyme It's a proteolytic enzyme that we know actually has blood thinning properties. This was actually discovered in Japan, and it's been used in cardiovascular medicine in Japan for decades. We also know that things like ginkgo can thin your blood. So herbal like ginkgo actually thins the blood. So there are supplements that can thin the blood, and then there are supplements that regulate normal blood viscosity, and that's the difference. Now, I have a number of different supplements and different preparations and formulas, and if you have a question, Roger, about a specific one, punch that into the feed or reach out to our customer service department. That's glutenology@gmail.com if you have a question about a specific product, and happy to get you an answer. Can Graves' disease be cured? Yes, I've seen Graves' disease go in remission in a number of people with gluten-free diet changes. A lot of times, most people don't have Graves, they have the opposite of Graves. Graves, by the way, for those of you who don't know, is hyperthyroid. It's an autoimmune hyperthyroid condition. And then you have Hashimoto's, which is an autoimmune hypothyroid condition. And that hypothyroid is much more common, and gluten-free diets, have been a number of research studies showing that gluten-free diets actually improve outcomes in Hashimoto's and help the antibody levels go away. Well, the same thing is also true in my experience, but also there have been some research on this in Graves' disease. So can it be improved upon? Absolutely it can. With severe carnitine deficiency, is taking 100 milligrams liposomal per day? No. I mean, if you've got a severe carnitine deficiency, you're talking, minimum 1,000, and probably more effectively 1,500 to 2,000 milligrams of L-carnitine a day, taken on an empty stomach, away from other protein sources, so that you can ensure its proper absorption. But 100 milligrams would be like trying to spit out a forest fire. It's not what we would consider to be a therapeutic quantity. And if you're doing that 100 milligrams 3 times a day, you're still not hitting therapeutic quantities. Movements in my stomach, and then my blood pressure escalates quickly to the point where I end up in the ER. Doctors don't have any answers. You need to get a full workup, Claudette. My advice would be find a functional practitioner who can do a full workup. There are 4 categories of things that would be a good place to start to measure. Number 1 would be food reaction. Number 2 would be chemical reaction. Number 3 would be microbiome disruptions, and then number 4 would be your vitamin and mineral status. Would you recommend to help with congested ear? Is it okay to use drops, essential oils, or peroxide in ears? I think it depends on why your ear is congested, but one of the best treatments for a congested ear is to have your ear adjusted. Melanie, if you have a good chiropractor, they can actually adjust your ears. There's a tube called the eustachian tube that helps drain the ear. So if your ear is congested, there's a pulling motion that can be done that extracts and helps open that tube up, and it'll help your ears drain and prevent them from getting quite as congested. But a lot of times, too, people have congested ears repetitively because of different types of allergens, and that could be a food allergy or a food sensitivity as well, so that may be a place to start for you also. Are there any supplements that support the regeneration of cartilage of the vertebrae? If you're talking about the disc itself, so like the disc, which is the cushion between the vertebrae of the spine, you need vitamin C because that cartilage is a collagen, right? And so to make collagen, what does your body need to make collagen? Well, 1, you can take a supplemental collagen. That's always something that can be helpful. Number 2, copper. Number 3, vitamin C. You need an array of B vitamins to support the energy production necessary to heal and repair that matrix, that disc matrix. So if you mean something other than the disc, Lisa, let me know. But those are places that I would start with. Now, there's some other supplements that might be helpful as backbone support, and that would be like glucosamine and chondroitin, which you also might find helpful. Is it okay to cook with clarified butter? I I think if you're new to the gluten-free diet, no, because even clarified butter like ghee is potentially problematic, and I've seen it be very problematic clinically for folks. So it's something that we keep out of the diet. Now, if you're 6+ months into a no grain, no pain diet, and you're looking to see whether or not you can tolerate that dairy, to me, if you're going to try or make the attempt, if you're doing ghee, it's got to come from an A2 variety milk, A2 variety milk. So that's really where a lot of people can't find that because it's not really widely commercially available. So avoiding it is the best thing to do if you can't find A2. And even if you can find A2, Edgar, you may find that you react to it anyway. A lot of people do, and this is, not everybody with gluten sensitivity does well trying to reintroduce dairy. As a matter of fact, the vast majority don't do well, even with A2 milk. So I would be real careful around that. Is oat bran gluten-free? No, oat bran is not gluten-free. Maybe we can put up our oat comprehensive article on oat for Laura. My question is, if I had my gallbladder removed and was told I'd need ox bile forever, whenever I take ox bile in general or TUDCA, I get uncontrollable diarrhea. Does everyone need ox bile? No, you've had your gallbladder removed, and many people with their gallbladders removed do really well with ox bile, and sometimes they don't, and it sounds like you may be one of those people. You can still digest fat without a gallbladder. It's just not as inefficient of a process. So, one thing you might try to do, Heather, is reduce the amount of ox bile that you take down to a level of toleration. And if you find that there isn't a level that you can tolerate, then I wouldn't worry so much about that. But what I would encourage you to do is get with your healthcare provider to make sure that your fats are not over time becoming deficient. Because my experience is it takes about 5 years to 7 years for fat-soluble vitamin deficiencies to really start showing up in people after they've had their gallbladder removed. And so it doesn't show up right away. And so vitamin A, vitamin D, vitamin E, vitamin K, as well as omega-3 fats are all considered to be essential nutrients, right? Meaning your body can't sustain itself without them. Those are the ones you're going to want to have monitored on a pretty regular basis. I like to monitor, when people come to see me, I like to monitor levels, twice a year and make adjustments accordingly. One of the other things you can do is consider supplementing with vitamin A, D, E, and K and omega-3 as a course of prevention because you don't have a gallbladder. So those are both options for you. What to take for weather headaches? If you get a barometric pressure type change, a lot of people that I see that have weather-based headaches, really one of the driving factors behind that beyond the weather, so the weather is like the proverbial camel that breaks the back, but the neck itself, the muscles in the neck are extremely tight, oftentimes have trigger points in them. So if you've got good chiropractor, good massage therapist, have your neck looked at to see whether or not you have those types of issues, because if those are there, sudden weather changes will exacerbate and increase the potential for that headache to occur. So I would look at that first. The other thing that, if you get a headache like that and you just want some relief, one of the things I really like to gravitate toward is white willow. White willow can be a very effective and very safe supplement that can help. Because white willow is actually where aspirin came from, right? The original, a lot of people bear aspirin, right? The aspirin actually is a derivative of the white willow bark, and so you can actually take white willow. And what white willow, it works a little bit differently than aspirin because it's rich in plant chemicals that have anti-inflammatory properties. So you can take something like that without damaging your stomach. Remember, aspirin, even at doses as low as 7.5 milligrams, can cause gastric bleeding. So it's important that you understand that, because a lot of people pop aspirin every day, right? And a baby aspirin is like 85 milligrams, which is 11 times the dose necessary to cause bleeding in the stomach. How soon do mycotoxins appear in the urine after mold exposure? relatively quick, depending on the quantity or depending on how much mold exposure you got. So, if you went into like a major environment where there was massive quantities of mold and mycotoxin exposure, you could see mycotoxins showing up within 24 hours. Remember, they're very tiny particles, mycotoxins, and they absorb. Not only can you breathe them in and get them into the blood right away, but you can also they can also absorb through your skin. That's why workers that do mold remediation wear those big Tyvek suits, right? Because it prevents the penetrance of mold and mycotoxins into their skin. Mold generally doesn't penetrate the skin, but mycotoxins can. Can I eat buckwheat? Is it safe on a gluten-free diet? We don't recommend it. Asenur, we don't recommend buckwheat for several reasons. One of the biggest ones is it's a Russian roulette game. The research on this, that's been done shows that when people buy buckwheat at the store, about half of the time it's cross-contaminated with enough gluten to potentiate a problem. And so that's one reason why I don't recommend it, because which half, right? Which half? Are you getting one that isn't contaminated? It's hard to know. And so it's a Russian roulette game, so to speak. And then the other reason why, this is my experience clinically, is when I see people try to gravitate toward buckwheat when we're trying to take them on a gluten-free diet, they usually they continue to be symptomatic, so they continue to have problems using buckwheat. So it's just something I don't recommend. There's 3 pseudo grains that technically they're not grains, but that's buckwheat, amaranth, and quinoa, and I really don't recommend all 3 for somebody who's trying to go gluten-free and restore their health. So Joy's asking if I would recommend Virid as a supplement for recurring herpes outbreaks on the cornea, and the answer, just like in the mouth, the answer would be yes. It's something I would recommend to support the immune system through that. Do food sensitivities activate lymphocytes and cause cortisol secretion? So food sensitivities, yeah, they engage your lymphocytes, and that creates an inflammatory process, and then that inflammatory process can engage cortisol. So cortisol, your body produces more cortisol in an attempt to fight inflammation. So if you're eating food that's causing the inflammation through your immune system, then yes, we oftentimes will see cortisol levels going up in an attempt to fight that inflammation being caused by the immune reactivity of the food. High calcium score on an artery test, if you're talking about like a Doppler test, any supplements to help break down calcium and help with inflamed arteries. So I could do a whole show on, what to be concerned by with that, Ralda. But I'll just start with, number one, if you have a high calcium score, consider taking calcium supplements is something that you shouldn't be doing right now, and making sure you have adequate vitamin K2, because vitamin K2 think of vitamin K2 as the air traffic controller for calcium. It tells it where to go, which generally we want it going into your bone, not into your arteries. But when calcium deposits into the arteries, it generally is doing so because there's inflammation in the arteries. So what are the things that you can do to support your arterial health and potentially reduce inflammation to the arteries? Well, one, you have to have a good diet. You have to have a really solid diet. So this goes back to, I would recommend no grain, no pain as a starting point, because it's an anti-inflammatory diet, and it might reduce that inflammation arterially to help relocate that calcium. Number two, also ask your doctor to measure. There are some other chemicals that should be measured to help understand better and to objectively monitor your risk as you move forward. So, homocysteine would be one thing to have measured. C-reactive protein, specifically high sensitivity C-reactive protein, erythrocyte sedimentation rate, a chemical called MMP9, which measures vascular inflammation, and then also apolipoprotein B and lipoprotein A are two types of subfractions of cholesterol markers that are linked to inflammation. So getting a baseline of those markers so that as you make diet changes and make supplement changes, the goal is if those markers are high, that you're seeing those markers kind of come down over time. That would be an indication that your diet and your supplementation are moving you in the right direction. But as just a general rule of thumb, some good things that you can do, good practices to support healthy blood flow and blood vessel function is, number one, make sure you're getting enough omega-3. Omega-3 is so crucial and so important, and most people are deficient in it. As a matter of fact, it's one of the top nutrition deficiencies. It's in the top 5 list. We have a top 5 list of nutritional deficiencies for those that are gluten sensitive, and omega is always in that top 5. So making sure you're getting 2 grams of concentrated omega-3, both EPA and DHA. A lot of the over-the-counter products today are very high in DHA, but have very little EPA. And when you're talking about vascular inflammation support, you need the EPA more than you need the DHA. So that would be something that I would say start there for sure. You also want to consider magnesium. Magnesium has a lot of anti-inflammatory properties. Vitamin C has a lot of anti-inflammatory properties. Niacin, which is vitamin B3, it can be very effective. As a matter of fact, the early studies of niacin in the 50s showed reversal of atherosclerotic plaquing in rabbits, not in humans, but in rabbits. And so a lot of doctors really like to use niacin, which is a form of vitamin B3 for people that have a history of vascular inflammation or atherosclerosis. Tips for health and new house environment after leaving a rental mold home in the last month. Wow, yeah, I hate that you had to go through that, but new home, number one thing you can do is control the humidity. If you're trying to prevent mold needs, basically it needs 3 things to grow. It needs air, which you're not going to get rid of the air in your house because you need to breathe it, right? Number 2 is food, which is what your house is made out of, mold food. And number 3 is water. And so the only one of those factors you're going to be able to control is the humidity. And when relative humidity in a home goes up over 50%, generally when it's hovering 55+%, you have enough ambient moisture to support the growth of mold. There's going to be some degree of mold spores in the home naturally. That's not 100% preventable, but it's when you have enough water there that allow those spores to replicate, grow, and then start feeding and growing out of control. So control the humidity. A lot of people fail to control the humidity in their bathroom. When you take that hot, steamy shower and all that water vapor goes into the air, well, if you don't have a ventilation fan or a window that you can crack in your bathroom, that water is going to go into the wall, right? And generally the wall is a sheetrock, right? It's a particulate board, and on the back of that board is paper, which mold loves to eat. So if you've got that constantly high humidity in your bathroom, this is a place where we see a lot of people end up where their mold problems start. So control the humidity is the number one tip I could give you. Now we've got some more comprehensive videos on mold as well that you might want to go check out. So Leah's asking about a supplement to support nerve, for nerve support and pain. Hands down, if we're talking about nerves outside of the B vitamins, the B vitamins, especially B1, B5, B12, would be the 3 big B vitamins. I don't see you having any B5 on your list there, Leah, so you might consider a B5. The other would be for neurological, to support neurological pain, would be cannabinoids or CBD. We have something called Ultra Hemp that I use in my practice that tends to work really, really well when we're trying to help people with that type of situation. So that may be, if you haven't tried that, that may be another one to attempt. What's the best bread you can buy at a store that's grain-free? I don't know. I don't buy breads at the store, honestly, Forex. I can't comment. Maybe somebody else watching has a good one that they've tried. So, if anybody's tried a really good grain-free, not gluten-free, not the breads with rice and corn and all that other nonsense, but an actual grain-free bread, maybe pump that into the feed for 4X. Are female hormones bad to take for life? I don't know. I mean, honestly, it depends on the person, depends on the woman. It depends on where her levels are at. It depends on whether or not she's had a hysterectomy, a total one or a partial one. It depends on whether or not she's got bone loss or has other symptoms of lack of adequate estrogen, if you're referring to female hormone estrogen. I mean, it's very unique to the individual. I would say if you're on a hormone medication and your doctor's prescribed it and is monitoring your levels periodically, then I would tend to be less concerned or less worried. Where we get worried about like estrogen, because a lot of people are scared of estrogen because there was a study done years ago that showed that taking estrogens could increase the risk of certain types of cancers in women. And although those studies were done on synthetic estrogen and not bioidentical forms of estrogen, so I would always say if you're entertaining the idea, then avoid synthetic and go with bioidentical. But number two, it's monitor the levels, because if you're a woman that's gone through menopause already, you don't necessarily want to have the estrogen level of a 20-year-old. There's a reason why you go through menopause, and I think we have to honor the wisdom of the body's natural declination in hormones. Now, a lot of people would have a different mindset than that. They want to recapture youth as long as they possibly can. I'm not here to judge you one way or the other, but I also believe that there's a reason that biology does what biology does, and it would be a huge overreach for any doctor, including myself, to claim that we know all the answers or have all the answers in that regard. But if you're trying to use estrogen replacement therapies, you need to work with a doctor and you need to have your levels monitored. And that would be, how you rule out risk. That would be how you make sure you're not getting too much. And so that's what I would say to that. What are your thoughts on carnivore diet to help with rheumatoid arthritis? Thinking about trying for a short time. Well, here's the thing about the carnivore diet, Alicia. I'm not opposed to it in the short term, but here's just my experience. I see lots of rheumatoid arthritis in my practice, and I've never had to put a single person on a carnivore diet to help them recover from their rheumatoid issue. Now, that being said, I'm not trying to take away anyone who's gone carnivore and experienced dramatic benefit or help, but my thought on that is the reason so many people do well with a carnivore diet with their autoimmune arthritis is because carnivore diet is a grain-free diet, right? So hence again, by default, eating only meat is grain-free. You're not eating grain, so you're eliminating one of the major culprits in driving the autoimmune process. That being said, there are other things that can contribute to RA pain as well that a carnivore diet can sometimes, or we should say a low oxalate diet can sometimes help, because there are oxalates in a lot of plant-based foods that oxalates are like little tiny glass crystal shards that can cause joint pain for many people. And so a low oxalate diet in many cases is sometimes necessary or also helpful. And so those two things, oxalates being one of them, gluten and grains being another, and a carnivore diet solves both of those issues. So if you were to go on a temporary carnivore diet to see if you felt better, I would imagine you probably would. But my concern with the long-term carnivore diet, a lot of people do really well with a carnivore diet in the short term, but the long-term ramifications I don't think are right for most people. I think there's an avoidance of adequate nutrition long-term with just a pure meat-based diet. How do you test besides blood for magnesium and potassium? So, if you're trying to get a good magnesium level from your doctor, one of the best tests that most doctors can order that they know about is a red blood cell level. So doing a red blood cell test. Now, a lot of doctors have heard of that. Now, they may not do it. They may have heard of it, but they may not do it because insurance may not cover it. And that's what a lot of doctors decide, whether they're going to order something, to decide based on whether or not insurance coverage has it. But you might be able to coerce or twist the arm of your doc to get red blood cell levels checked. But my favorite way is lymphocyte proliferation, and that's using white blood cells and the functionality of those cells as a marker for adequate intracellular nutrition. I don't know, Deborah. So the question is, I went to the oral doc and he said I probably have oral lichen planus and wants to do a biopsy in a bad spot. Could cause receding gum and nerve issues. Should I have a concern? I think, yeah, you should always have a concern when you're talking about any kind of invasive procedure. I think you have to weigh the risk versus the benefit. You know, I would have a deeper conversation with the doc on all the different risks involved versus the benefit as a place to start to ease your mind. Yeah, so Anna's asking about a comment you left on another page on another YouTube video from 3 years ago. You're gonna have to repost your commentary here, Anna. I'm not gonna go peruse through my archive to find your question and answer it. So you're here today, you can ask your question here today, and I'll do my best to answer it. Clonazepam, does it contribute to any nutritional deficiencies? B vitamins is what I would be the most concerned with if you're taking Xanax or clonazepam long term. Have any idea why hip bones would itch? I mean, the bone itself or the skin around the bone? Clarify for me, because they're different things. I've been taking your NAC, Hist Assist, and Ultra Q, and Virid. The doctor did a virus and bacterial test, which came back negative. I'm wondering if any of the supplements could affect the results. No, I mean, they could affect your immune system in its ability to help you, combat virus and bacteria, but taking those supplements directly, before the test is not going to impact or affect the test result. Oh, thanks for the comment. It says, love your military high and tight haircut. I just got it this morning, so thanks for noticing. Intestinal defense, liver flukes out, thank you. Oh, I guess you're sharing your experience, Kathy. We have a product called Intestinal Defense, which is a mixture of wormwood and artemisinin and some other things that are designed. We use it as a natural way to basically to deworm our family, because we live on a farm, and so we use that naturally every month, and it looks like she just had a good experience using it. Thank you for sharing. Itching under toenails like the nail bed. That could be yeast or mold overgrowth underneath the nail bed itself. A lot of times that's also accompanied with like a nail discoloration, so the nail itself can start to turn yellow. If you've got that, and most likely you've got yeast growing there. The yeast is an opportunistic microorganism, so when your immune system something is challenging your immune system, it's easier for yeast to get a hold underneath the nail beds and on the skin. You might have your doctor check that out and confirm it. What also I find can be very helpful in this situation is a peroxide soak, so soaking the nail itself or the toe in just a normal over-the-counter hydrogen peroxide, and you can get it over at the local drugstore. The most accurate and least invasive method to find out if one has colon cancer or breast cancer. So there isn't, to get a confirmatory diagnosis, in other words, to be 100% sure whether or not it's cancer, for colon, you got to get a colonoscopy, and then they have to take a biopsy and confirm whether or not it's cancer, because the way you confirm it is by pathology, meaning you take a tissue sample and look at it under a microscope and see, are these cancer cells? That's the only way to truly confirm it. Now, there are tests that you can do that help you understand whether or not you need to go and worry about having that colonoscopy, or in the case of breast cancer, that mammogram. So there are less invasive methods of just kind of assessing the colon. And one is a new test that most doctors are now using as a precursor to a colonoscopy, and the name of that test is called a Cologuard test. And so you can talk to your doctor about getting one of those. It's not, if it comes back positive, it doesn't mean you have cancer, but if it comes back positive, it prompts your doctor to order a colonoscopy to go in and look to see if you have cancer, as opposed to just doing the colonoscopy first. And then with the breast cancer, there's a type of test called thermography, which is where they're measuring heat signatures of breast tissue to determine if you have hot spots in the breast, because hot spots can be indicative for cancer cell growth. And so that, again, it's not a definitive test for cancer, but if you're considering a mammography, but you don't want to be radiated with all that radiation, you might consider a thermography first. And if you have thermography test that's completely normal and you do self-breast exams and there's no lumps or anything that you can detect that's abnormal, then you can make a better decision about whether or not you want to go and do something deeper. Ever since COVID, I have bad brain fog and sinus congestion. Is there a question there?
I think it continues.
Okay, so just severe brain fog. What could I take for this, and what can I? Okay, so if you've got headaches and brain fog post-COVID, I can't really tell you what to take for certain that would fix it. But I can share my experience. So a lot of the people that I see that had a really bad COVID issue and then they're failing to recover well after it, what a lot of doctors are calling long COVID, a lot of these people have mold issues. And so, I would suggest that if you've had a really bad experience and you're still struggling, have your doctor check for mycotoxins, mold toxins, because what happens is people get sick and they stay home. And when you stay home, if there's a lot of mold in your house, your body's immune system is already being overwhelmed by a new infection, and now it's also having to deal with the environmental or ambient mold potential. And so again, it's just been my experience that every case of long COVID that I have seen, those individuals had a major ordeal with mold exposure, meaning they were either living in mold, working in mold, or their car had heavy amounts of mold, and they were commuters, and so they spent a lot of time in their car. And when addressing that, a lot of their symptoms start to subside. So I would suggest you look into that. If mold ranges are deemed normal ranges by air testing, but serious health illness to the whole family has happened and being out of that home, health has become better, how do you know what's normal for the autoimmune disease people for mold? So, air testing, Mike, is one of those things where it's not real reliable. And any expert in mold can tell you that an air test for home, to try to identify mold in your home, is one of the most unreliable, as a matter of fact, ways to measure for mold, unless your mold problem is so severe, meaning that where we'll see air tests come back positive is when we have visible mold growing on a wall, which you got that, you don't necessarily need a mold air test, right? But so air tests are not super accurate. So better way to assess the mold issue in a home is actually to test the human. And so one of the best ways to test the human is to measure for mycotoxin excretion in the urine. Now, mycotoxins are the metabolites produced by mold. And so if a person's levels are very, very high, we know that they're being exposed to mold. Now, if that person stays at home, lives at home, doesn't have a job like a housewife or a child, and their levels are high, then the assumption is that those levels are actually coming from the home itself. And then from there, there are different levels of mold inspectors. So most mold inspectors, depending on the state, and I can speak for Texas, it's a weekend course. You take a weekend course and you can get certified as a mold inspector. That's not a lot of knowledge and education, unfortunately, because mold inspectors have a very important role to play in finding mold. And if they don't understand mold, and they don't understand mold illness very well, and they don't, it only requires one weekend class, then they're not going to be really good at going and finding it. So, when you're looking for somebody to come and inspect your home beyond doing urine mycotoxin tests to see if you have mold in you, it's very important that you reach out to a company that has more of a forensic approach to finding mold. So like an air test, if a company comes out and does an air test, fire them. They're not worth your money. You want a mold inspector that's going to do, they can do air testing, but they should also do humidity checking, They should check your HVAC system. They should potentially drill holes in your wall and check the air cavity of your wall envelope or of your house envelope to make sure that there's no mold penetrance or mold permeating inside your wall cavities that is not showing up visibly as growth on your wall. So infrared cameras can be helpful as a tool. Air testing, not from the perspective of doing an air test to detect mold spores, but air tests in terms of using a smoke generator to see what the airflow in the house looks like, because sometimes you have airflow problems that can contribute to the genesis of mold sporation. So there's a lot of things to understand, and you need an inspector that has a knowledge of those things. Maybe what we'll do, you can email glutenology@gmail and ask them to send you what we have. We have a document in my practice. It's called a mold guide, and it's for people who are not sure who to hire and looking for a company to come out and do a mold investigation in their home. But it's a bullet list, it's a checklist of the criteria that person should be able to fulfill. And if they can't fulfill the criteria on this list, then I wouldn't hire them. And I had to create this list out of my own necessity, because we had in my own house, we had mold, and it killed my dog, and it poisoned my wife and poisoned myself and my son. And we went through several mold inspectors before we could find one that actually was able to find it. But he was so good, he found it in less than 10 minutes. And so that's why you want a really good, really thorough mold investigator. Do I have a recommendation for a 2-person far infrared sauna? No, not specifically. There are a number of different companies that make saunas, and I think from a technology perspective, they're all about the same. But if you're looking for a 2-person sauna, then probably the thing to do is to look for a company like I think Sunlighten is one popular company where they make enclosures, right, so that 2 people can go in at the same time. Any thoughts on the body mistaking Saccharomyces boulardii for gluten? No, it's actually not something that I typically see at all, not with Saccharomyces boulardii. There are other species of mold that we see with gluten mimicry. The one that's most well researched and studied is actually Candida albicans, to be specific. There have been some research studies that show that it produces a protein called a hyphal wall protein that mimics gluten. So people with Candida overgrowth that are gluten sensitive really, really do poorly. Any remedy against tendinopathy apart from no grain supplements as for disc problem? Oh, so tendinopathy, yeah, there's some really good things you can do for tendons. One is take collagen. Number 2, vitamin C at high dose, 5+ grams a day. Number 3, quercetin or Ultra Q, which we have, is a high dose potent quercetin that is a very, very potent bioflavonoid. It can be very helpful. And then I don't know what number I'm on, 3 or 4, something called matrozyme. Matrozyme is a proteolytic enzyme designed to support tendon, ligament, and muscle repair. So those are places I start. The other thing I'd make sure that you're doing is get enough protein in your diet on a daily course. A lot of people with chronic injuries, they're under-consuming protein as a general course, and so they're not healing very effectively, and they're more prone to having breakdowns of tendons and ligaments because they're less vascular. They have a smaller blood supply, so they don't heal quite as quickly as, say, a muscle will. How do you feel about neti pots? I like them. Neti pots are good. If you've got sinus congestion, they can be very helpful. What can I do to rebuild from shingles? You mean you had shingles, severe case of shingles? Good nutrition, good rest, lots of vitamin C, lots of quercetin, lots of zinc. Virid is a good formula. We've talked about that before. It's a good formula for that to help you kind of support your recovery. Somebody's asking about the surgery protocol. So we have a surgery protocol, which is a nutritional protocol that you can take before and after surgery to help support healing. Yeah, we can post that. You know where that is, Mel? I just put it up. Okay, yep, we put it up for you. I heard pistachios has a great amount of natural melatonin and tyrosine for sound sleep. That is correct. You heard right, Bella. That is absolutely right. Yeah, I like that. So we comment saying that Dr. Osborne's recommendation for sleep has worked consistently for me. Nothing else has. That's vitamin B1, magnesium threonate, and choline citrate. Dreams have finally returned after years without them. Love hearing that. Do you think benfotiamine could help with leg stiffness, hard to bend knees on MRI, no signs of injury, and blood tests are okay as well? Maybe, but if your legs are stiff and your muscles are tight, B1, is it possible that it could help? Choline could help, magnesium could help. That's kind of a deep question because stiff legs, I mean, there's just so many things. One of the things I see that cause stiff legs the most, really, honestly, is inactivity. Where people get stuck in a chair all day at work and they're sitting or they're just not exercising consistently enough. And so over time, their muscles atrophy and they become tighter and tighter and tighter. And then it becomes hard to do functional things like bend the knee. There's not a person in this audience that shouldn't be able to sit down on the floor, bent kneed, where your knees are touching the floor and your heels are behind you and you're sitting on your butt on your heels. Like if you can't do that, you have mobility problems, and those mobility problems could be nutritionally related, but they could also just be lack of activity related. And sometimes it takes both. It takes good nutrition plus mobility. And so finding a good doctor that understands mobility and can help strip any kind of fascia issues that you might have or any kind of trigger point issues that you might have or tightnesses or imbalances muscularly that you could have that's contributing to that might be another avenue for you to pursue. Biggest thing, if you're going on a carnivore diet, the biggest thing I would suggest that you do if you're just trying to take a carnivore diet and apply it is to be on, is number one, be on a good multivitamin like Ultra Nutrients. Number two, be on a good fish oil, because most carnivore diets do not have enough EPA in them to meet your need. I mean, unless your carnivore diet includes heavy fish, heavy cold water fish. Beyond that, you might also consider a solid B complex vitamin, especially if you're doing carnivore without organ meat, because different people do carnivore differently, right? And so if you're just eating steak and beef, but you're not eating organ meats, you're going to need B vitamins, you're going to need minerals, more specifically. So, again, just supplementing through that diet depending on how you're doing carnivore. If you're eating organ meat, look, liver is one of the best sources of nutritional dense food you can get your hands on. So that's, if you like liver, that's really one great thing about trying that carnivore diet is you get really rich nutrients from the liver tissue. There's a question about what about lumbrokinase, and I don't know what you mean. What about like in regards to what? I'm not sure I understand your question. My alk phos is continually low on my LabCorp, have functional med doctor run over the past 6 years. Concern, what exactly is alkaline phosphatase? Alkaline phosphatase is a chemical made or produced by your bones. It's also produced in your GI tract. It's also produced by your liver. And generally speaking, low alkaline phosphatase is more an issue of digestion, in my experience, where a person has low alkaline phosphatase. A lot of times they have a harder time digesting animal meats, animal proteins, and oftentimes low alkaline phosphatase can actually be caused by low levels of zinc. So, but it's not definitive, right? If your doctor ran a bunch of other tests, you might consider them checking your lymphocyte zinc levels, but zinc deficiency can cause low alkaline phosphatase. But also many people with blood type A make low levels of alkaline phosphatase just kind of naturally. They make lower levels, and this is one of the reasons why type A blood types do better eating less animal protein and do well eating a heavier plant-based diet, let's say, than certain other types. Is it possible to take too many supplements? It is. So you take B12, a prenatal, vitamin D3, K2, omega. If you're taking folic acid and you're pregnant, one, I would say get rid of the folic acid. You need to take folate, not folic acid. Folic acid is bad news. And unfortunately, because doctors typically don't train in nutrition, they don't understand that. And they think folic acid is going to prevent neural tube defects. And in reality, folic acid is unhealthy. I would consider using methylfolate instead of folic acid. You know, pregnant women do need folate. Folic acid is a synthetic folate. So take methylated folate. We have something called 5-MTHF that you can use if you're trying to get more folate. And then if you're, well, I don't understand why you would be taking a baby aspirin while you're pregnant unless you have another, like a clotting condition that your doctor is trying to address. But, you know, remember that baby aspirin causes folate deficiency and vitamin C deficiency and iron deficiency. These are not deficiencies you want to have when you're going through pregnancy. So I'd say the best thing to do if you're pregnant is really to ask your doctor to test your nutritional status so that you have an idea of what is too much versus what is not enough. Black floaters in the eyes. There are different reasons why that happens, but one of the biggest reasons that black floaters in the eyes are consistent is blood sugar problems. So, you know, check your hemoglobin A1C, your insulin, your C-peptide, and make sure your blood sugars are stable as you go through your pregnancy. The name of the spore probiotic that I mentioned earlier is called Biotic Force. Biotic Force, maybe we could put a link up. Naturally occurring vitamin E exists. Okay, is that a question or is somebody just making a comment? It's just a comment, okay. Do I need a supplement? Oh, okay, the comment is, do I need a supplement with all 8 of the naturally existing forms of vitamin E? If your vitamin E levels are deficient, it might be beneficial to do that. But otherwise, if you're just wanting to supplement with vitamin E, I mean, yeah, I mean, you could use one that has all of the natural tocotrienols and tocopherols as well. I have no gluten allergy or intolerance. Should I nevertheless stay gluten-free? You know, I think if you've been genetically tested, then you could make that statement. But if you haven't been genetically tested, I don't think you could make that statement that you have no gluten allergy or intolerance. I think you could maybe make the statement that I've eaten gluten and I don't feel bad after I eat gluten. But that doesn't mean you're not gluten sensitive, and because that's a genetic issue. So if you haven't been genetically tested, I don't know that, you know, that you could make that claim. I would just simply say, if you want me to give you a direct answer, get genetically tested, and then I can tell you whether or not you should avoid gluten. How much are supplements actually absorbed into your what? Into your body? It's a variable question because supplements are absorbed based on the integrity and the form and the quality of the supplement, but also the health of the GI tract itself. So, you know, and the health of the pancreas and the health of the liver play a role in that. So I think it just depends on the individual, but supplements generally are very well tolerated and very well absorbed by most. Should I avoid Ceylon cinnamon? I mean, if you're allergic to it, I would avoid it, but beyond that, you know, I wouldn't so much worry about it. Most effective supplement for scar tissue in the liver? You know, if you're trying to support your liver, probably one of the most effective things to use, 2 things really. One would be silymarin, which is an herb from milk thistle, or a derivative of milk thistle, and the other would be choline. And choline citrate specifically at higher doses, you know, anywhere from, you know, 1,000 to 2,000 milligrams a day if you're trying to really support liver function. Is it better to avoid all pseudograins? I think I answered that earlier. Lucy, yes, it is better to avoid all pseudograins if you're following the no grain, no pain diet. Okay, so near the nuclear power plant leak in Minnesota that no one told us about during the holidays, what can be done to offset the exposure? You know, it's never a bad idea to take iodine. You know, iodine has, you know, definitely against nuclear threat, iodine has a very powerful anti-effect. We did a show, I think, on that, but I'd start with iodine, you know, anywhere from 12.5 to 25 milligrams of iodine and iodide mixed. We have a product called ultra iodine that can be used in that regard. But it also would be important to not just take that indefinitely and forever. Iodine, too much iodine in the wrong person can, you know, contribute to the formation of goiters. So too high for too long. So getting the level measured periodically to make sure that you're not overdoing it as well is a good idea. Serrapeptase for acne. I think if a person has cystic acne, serrapeptase is not going to solve why they have cystic acne. Cystic acne, in my experience, for most people that have it, is diet related. So you can use serrapeptase, but it ain't going to fix it. You got to fix your diet. Do I have a PDF list where all allowed foods are listed? Not a PDF list, but it's called No Grain, No Pain, the book. It you know, breaks down all the allowable foods and non-allowable foods. I started taking berberine and love it. Do you know if it's safe for dogs? No, I'm not a vet, so I don't want to comment on animal health. That's just not my level of expertise. Sorry, I couldn't be more helpful there. Is taking laughing gas okay for dental issues? Yeah. I mean, you know, I think part of it is, you know, what kind of health do you have? Does your dentist recommend it? Do you get really antsy around dentists? Do you have a fear of needles? I think all those things play a role in weighing whether or not, you know, using laughing gas would be the right move for you to make going into the dental chair. If No Grain, No Pain is not available in your country, you know, what I would suggest that you do is go to glutenfreesociety.org. And, you know, there's thousands of pages of information that you can peruse through. And we have comprehensive lists of things that contain gluten and don't contain gluten there as well. So, again, if you're in a foreign country, or if the book is not available in your area, you can go to glutenfreesociety.org. My aunt has MRSA in her nose. What can you recommend? A lot of people have MRSA in their nose. It doesn't necessarily mean they have a problem. So, you know, be cautious around that. Is MRSA, which is methicillin-resistant Staph aureus. It's a type of bacteria, but it's a common inhabitant of the nose, and so a lot of people have it in their noses, and it's not necessarily pathological or creating a problem. You know, I've seen it where cases where people's doctors were pumping them full of nasal antibiotics and they were just getting sicker and sicker and sicker. So I would just say, you know, be careful around that. If you have MRSA in your nose, is that MRSA contributing to some type of upper respiratory problem? And if it is, then, you know, then now you want to consider potentially talking with your doctor about doing the right thing. But if you know you have MRSA in your nose, you should have also done a culture to find it, and they should have done an antibiotic check with that culture to see which antibiotic would be best suited to kill the MRSA that you have, because by name, it is an antibiotic-resistant strain of staph. And so, you know, that means which antibiotic will work. That's what your doctor has to test for in order to, you know, to make the right prescription. Now, some people also find that using like silver in the nose is helpful to support the immune system in that area. So like a nice nasal silver spray, some people find is beneficial. What about berberine for heart health? I like berberine as a supplement. I think it has a lot of potential benefits. It's actually sometimes referred to as the natural metformin. You know, in the longevity research, metformin, there's some research showing that metformin can prolong lifespan. Although I'm not a big fan of metformin because it can be genetically toxic, and it causes CoQ10, B12, and folate deficiency, but berberine doesn't do those things. So I'm a fan of berberine if you're just using it as a natural supplement for heart health support. I think that's perfectly fine. I think the question about what would I recommend somebody with valley fever use supplementally, I think, Anna, if you go and look at our immune support protocol, that would be my general recommendation for it. If we can probably post a link to that for Anna. Tell us about iodine. I have a whole crash course on iodine that you can check out if you'd like to learn more. What was suggested for the herpes virus? So to support your body virid, V-I-R-I-D, did we put a virid link up? That question it's like come up like 10 times, I think.
I did. I'll put
Okay. Yeah, so check out, it's below, Patricia, check out that link on virid. What is essential in plants, which is not in meat? Which kind of meat? Because there are a number of nutrients that are richer in plants that may not be specifically found, say, in beef. Now, liver is a different matter. Liver is like a powerhouse, but if we're talking about eating other meats, I think you've got to be cautious about, without organ meats, I think you've got to be cautious with the carnivore diet, not ending up with a problem. I mean, one of them being vitamin C. Being lower, in liver has it, but in adrenal organ meats have it. But most people are not going to, when they go carnivore, they're not eating adrenal glands. They're not eating enough liver or maybe enough organ meat altogether. Can I take ultra nutrients and multi-nutrient vitamins at the same time? You can, but you don't need to. I mean, if you're taking one, you don't necessarily need to take the other. They're both multivitamins. But if you're just trying to mix them, you could do that. You just don't want to take the full dose of each one. You're just doubling up. My eyes keep getting rashes. Can that be from an allergic reaction? Yes, it could be. And yes, I've heard of it before. A lot of times especially right now, we're in the spring, and so allergies are higher right now, depending on where you live and what you're allergic to. But I'm talking about environmental, but then food allergies and food sensitivities can also contribute to rings around your eyes like that. So be cautious there. Thoughts on serrapeptase versus lumbrokinase? I think it depends on why you're wanting to use it or why you're wanting to take it. I mean, they both have subtle different indications, so what are you wanting to use it for? Root canals extracted from biological dentists due to infection and bacteria. What do I think about root canals being extracted from biological dentists due to infections and bacteria in them? I think it's a good idea. I think if you've got a good dentist, environmental or biological dentist, who helped you identify an infection under your root canal and helped you get it removed, I think that is potentially a life-saving thing to have done. Cone beam scan from biological dentist. I think it's a good idea if they suspect you have an infection in your mouth underneath your gum line that's not detectable with the naked eye. Yes, you should protect your thyroid with a guard. Generally, with a scan like that, a dental scan, they'll give you an apron that protects you. So not a bad idea anytime you get any kind of procedure with radiation to wear, if they don't need to take a whole body scan, to wear, a lead liner to protect you from, radiative exposure as much as possible. What if exposed to mold years ago? I've been told that mycotoxins can live in my body from years ago. Mycotoxins have a very short half-life, Barbara. So if you were exposed, years and years ago to mold, and you got out of that mold and you recovered and you're relatively healthy, you shouldn't still have mycotoxins showing up in you. Now, if you've got detoxification issues, if your detoxification pathways are not functioning well, then there's a possibility, but you shouldn't see pathologically high levels of mycotoxins coming out of your body from mold exposure 5 years ago today. I like this comment. So Andrea says, I had an architectural firm who specializes in restoration do a mold inspection for me recently. Very, very thorough in as much as they represent buyers of older buildings. Yeah, I mean, that's what it takes. You got to find the forensic folks. And one of the best ways to do that is to call the attorneys who represent mold cases in your area. Sometimes the attorneys can lead you to really solid mold inspectors or other companies. Sometimes, when we were going through it, we actually had an architectural firm come out. We had a specialty HVAC company come out. We had a mold inspector come out. We had an engineering firm come out. So like we wanted to find it and we wanted to know exactly what was going on, and it was expensive. And I don't wish those kinds of expenses on anyone. But the way I saw it was, there's no amount of money worth your health, especially when you're living through something, aggressively that's killing you. So to me, I had to know in order to be able to have the decision, to make the decision on what to do. And sometimes, the knowledge is power. And so, having the right people in your court can be invaluable. Let's see here. What questions to ask a local chiropractor to work with my muscle imbalances and not adjust me? I think you just have to, there's not really any specific questions. I think you just have to go in and have an honest conversation if you're nervous about being adjusted per se. And find a chiropractor maybe who has additional credentialing in muscular imbalance work. So this would be like, there's a DACBO is an acronym after, so many chiropractors have gone on to school for an extra 2 to 3 years. And DACBO stands for Diplomate American Chiropractic Board of Orthopedics. And so these guys are just trained longer for this type of thing. So that might be also something that you want to look for. So many companies are using part of rice kernel in their supplements to help get the substance to flow. Yeah, they're using rice and rice flour as flow agents. And I don't like it. I think it's a bad idea. And I have a ton of people who come to me with those types of products and they're sick because they're trying to be gluten-free, but they're not really grain-free, and that rice is contributing to part of their problem. So my thoughts on products that contain rice and rice-based ingredients is throw them in the garbage if you're gluten sensitive. If you need to be avoiding grain, you need to be avoiding grain, and don't make the exception. And I've actually even heard doctors say, well, a little bit won't hurt you. And those are the kind of doctors that I say run away from very, very fastly, because they're not up to date on the research on this. Mold in your garden soil, I smell it when I'm outside. Is there any way to get rid of it? There's naturally mold in garden soil, so I think, could you have a contamination of potential more mold, and could there be an imbalance in your garden soil? Possibly. What you may want to do, Lita, is reach out or contact your local master gardener club. And most areas have one where these are people that go through extensive training on soil conditions and on plants. And so you may get some better answers, because you may just have garden soil that is over-contaminated and it's not good soil, in which case they can guide you better through that than I could. So I did a food sensitivity test, and where egg white showed up to be a problem. Should I also avoid eggs altogether? Yeah. So the yellow, you should also avoid the yellow. It's very hard to separate the white and the yellow. So, if you showed up reactive to one or the other, my advice when I test people, and that's the case, is I tell them to avoid the whole egg. So if you've got low iron and it's not coming up, even though you're eating plenty of iron in your diet, one, you can add supplementation. We have something called ultra iron, Evelyn. The other would be to figure out whether or not you have any blood loss, happening, what's called occult blood loss, where sometimes you can lose blood through your gastrointestinal tract. So like if you've got stomach or intestinal damage, you can have blood loss through your stool and you don't see blood in the stool because it oxidizes and it turns brown. That's why it's occult blood loss. So ask your doctor to run an occult blood loss test to see if maybe your iron is not coming up because you're actually losing enough blood on a regular basis due to intestinal damage. But that would be, it's very common, and we see that a lot when people with gluten sensitivity, we see what's known as refractory iron deficiency anemia, where no matter what they do, they can't get their iron levels up because the gluten is damaging their gut to such a great degree that they're losing blood faster than they can replenish it. Okay, I think we're way over, aren't we? Yeah. We're like 42 minutes over. You guys got the Easter gift today of 42 extra minutes of Q&A. So I've got to go eat lunch. I wish you all a fantastic Easter weekend. May peace be with you. And I will see you back here next Tuesday, 6 p.m. We're going to be talking about toxic metals. It's a show you don't want to miss, especially if you've got concerns about toxic metals in the environment, potentially creating problems for you. So we're going to be doing a dive into toxic metals. We'll see you Tuesday. Have a fantastic Easter weekend.